Hi everyone, Dr. Harmon here. Today I'd like to discuss a question I'm asked frequently in consultation, that is how do I treat roundedness in my face or over-roundedness in my cheeks? I like to break this down into a couple locations, and first I'd like to say it's important that you have an in-person consultation with a fellowship-trained facial plastic surgeon, in my opinion, in order to determine whether one approach is best or another approach is best to address concerns about roundedness in the face. In some instances, that roundedness is mostly contributed to by the buccal fat. The buccal fat is located in very complex three-dimensional space deep in the face, and that's why it's accessed through a small incision on either side of the inner lining of the cheek. It surrounds important structures, including blood vessels and nerves and a duct that supplies saliva from the parotid gland into the mouth. And only a portion of that fat can be removed. The part that the buccal fat contributes to mostly is the space between the superficial fat pads in the upper cheek and the superficial fat pads in the lower cheek in this location here. And so some individuals may potentially be a good candidate if most of the roundedness is in that location. Again, it requires a physical exam to determine that, but that's one consideration I have. There's another contributor to roundedness in the face, and that is the superficial fat pads in the lower part of the cheek. When they drop, hanging down and over the jawline and forward, forming marionette lines, they form jowls. And those jowls are simply superficial fat pads. Now, anecdotally, many surgeons notice that that fat pad can get larger in some individuals with age, and that accentuates the appearance of the jowls as they fall down and forward over the jawline. A facelift of some type can bring those fat pads up and back closer to where they were before, but that doesn't decrease the size of the fat pads themselves when they're lifted. And unfortunately, in many instances, you can't reduce the size of those fat pads. In a very small select group of individuals, microliposuction, which is the use of a tiny cannula to remove some fat, may be appropriate. But when you're weighing the risks and benefits, the reason most people aren't great candidates for it is because there's a higher risk of lumpiness, bumpiness, contour abnormalities like divots, for example, from the removal of some of that fat. So that's why it's important to have a good consultation and a good discussion about those concerns, because the potential contributors to roundedness in the face are complex, multifaceted, and in some instances there may be an appropriate and safe treatment, and in other instances it may not be worth the risk-benefit analysis.